Hear the whispers from within, balance to restore, ailings to relieve. Feel the nature keeping us, nature healing us. Flowers, leaves, and roots within. Hear the mind calming you, soothing you. Love and kindness inside out. Let the herbs from middle world heal. Welcome wellness, welcome wellness. It's revealed herbs, middle world herbs.
Hello and welcome to the Middle World Herbs Natural Wellbeing Series, where we talk about restoring and maintaining your health in safe and natural ways while incorporating both the physical and the emotional sides of healing. And we go live twice a week on Wednesdays and Thursdays at 4 p.m. Pacific Standard Time. And every single week we talk about a different aspect of health. Well, today's episode is called Heart Health, Hard Questions. And we're going to focus on heart and cardiovascular health. So why do women care about heart health? How do you know how healthy your heart is? What is the #1 supplement for heart health and prediabetes? And we've selected the 20 hardest questions from our listeners, and we're going to go ahead and get them answered today. So my name is Deanne, I'm your host, and I'm here with our special guest, Dr. Jacquie N.D, a naturopathic medical doctor, board-certified holistic nutritionist, and a psychology enthusiast. So Dr. Jacquie, welcome as always. Thanks for joining us on our episode today. So would you like to briefly introduce yourself and share with us some of the most common heart health-related issues you are seeing with your patients?
Yes, of course. Also, I love that you got the memo. Today's Black Shirt Day.
Yes.
We coordinate so nicely. I know, we're on the same wavelength. So, okay, so I'm Dr. Jacquie, a naturopathic doctor, and I have successfully treated a myriad of cardiac issues, cardiovascular disease issues. Some of the most common that I see in practice is going to be hypertension. It is the most common thing I see. Hypertension, as we all know, is high blood pressure. It's usually concomitant or along with another handful of things like metabolic syndrome, obesity, high cholesterol. Not always, but a lot of times those are also issues that we're managing in patient care. I have also managed things like left ventricular hypertrophy, which is where the left side of the heart gets really, really large and thick, almost like it was lifting weights, because it has to push and use so much pressure to pump blood to the rest of the body. So it gets bigger because it's working harder. Valve stenosis, mitral valves specifically. So when the leaflets don't close in the valves, that's a pretty common one. So you get what's called regurgitation. So if it doesn't close completely, and it's left a little open, some blood can come back in. And so if you have regurgitation or stenosis, you know what I'm talking about. It's actually more common than we think. And then this isn't directly related to cardiovascular, but it affects the cardiovascular system. See lots of heart stuff and vascular stuff with people with anxiety. My patients with anxiety, palpitations, lightheadedness, feeling a weight on their chest, things like that. So those are probably the most common things that I see in practice that are heart-related health issues.
Interesting. And is the anxiety is causing the heart stuff, or is the heart stuff causing the anxiety, or is it combo?
Chicken or the egg, it really depends on the person. Some people who have been struggling with anxiety their whole lives, that's usually causing the heart stuff over time, because they're very highly linked. But if you have high blood pressure for a long time, or if you have issues with an increased pulse rate for a long time, sometimes that can lend itself to feeling anxious as well, or you can't really, your heart's racing just brushing your teeth or doing some normal mundane task, which can feel like anxiety when in reality it's a cardiovascular issue. So it really depends on the person, the patient, how they're taking in, because some people, I'm sure it's like we have a thought or a physical feeling and we instantly attach a story, right? I'm anxious, I have this issue, I have that issue, this problem is overwhelming. Where some people are more in their physical body and it's like, this is just chest pain or palpitations. They don't have the story or the emotion attached. And so it really just depends on the person and their health history, but that's a really good question.
This is interesting. Okay, well, before we jump into all the hard questions, because we have 20 questions coming at you today, I want to introduce everyone to our amazing supplements from Middle World Herbs, which you might want to consider for your heart health. And if you're dealing with high cholesterol, high blood pressure, or if you've had some pre-diabetes signals in your last blood work. So we have our berberine HCl40, which is a powerhouse of benefits for cholesterol, triglycerides, and heart health, paired with extra bonus for blood sugar support and metabolism. And then we have our berberine with bitter melon. And this one has all of the above of the berberine HCl40, but also has that bitter melon, which gives you that extra support for cholesterol levels. And then we have Middle World Immune Support with quercetin. And this one, quercetin has been known for blood vessel relaxing properties and also for supporting cardiovascular systems through the positive impact on blood pressure and cholesterol. So it's not only immune support, but also heart health as well. Now, the regular price on Amazon for these supplements is $19.49 for a bottle of Middle World Berberine HCl40, $21.49 for a bottle of Middle World Berberine with bitter melon and banana leaf, and $20.49 for a bottle of Middle World Immune Support with quercetin. But I have some really good news. So for all our friends who are watching us live or listening to us live, we have a 20% off coupon on Amazon Live. So all you have to do is click the little banner, and then that will apply the discount to those 3 products automatically. It's valid for today only and only during this live. So you definitely need to take advantage of that and grab yourself a bottle of natural heart health support from Middle World Herbs and enjoy that 20% checkout discount. All right, well, let's get into the hard questions about heart health from our listeners. So if you do have a question, please type it in the chat. We will make sure you get an answer from Dr. Jackie. She's our amazing expert in naturopathic medicine. So our first question comes from Rose R. And Rose, if you're listening to us today, here's your question. So what are some of the early warning signs of heart disease I should look out for?
So some of the early signs of heart disease to look out for. Sorry, I was trying to get back to the Amazon. I wasn't seeing it play. I was getting messages like, where are you? Okay,
Oh, no.
So early signs of heart disease. So some of the most early signs of heart disease where it could or could not be heart disease. So when I say these, please don't freak out and assume. Go see your physician if you are having any of these signs or symptoms so that you can get looked at. But if you get very breathless very easily from very little activity, or even at rest, you feel kind of out of breath just sitting there watching television, getting up to use the restroom, going up a single flight of stairs, these are all signs that your heart is working hard, and we're not reoxygenating the blood efficiently enough. So remember, breathlessness is very important. If you have what's called edema or swelling of the legs, especially the lower limbs, because when our blood pressure is affected or the way our heart works, the further away the system or the organ or the limb is from the heart, the harder it is to get blood there. So blood's not pumping and returning and pumping and returning. And so we get fluid retention. So the legs, being as far away from the heart as possible, tend to get the most fluid retention, known as edema. If you're really, really exhausted all the time, if you notice you have irregular heartbeat, meaning sometimes it feels like your heart's racing, sometimes it feels kind of fluttery, other times it feels like it might be pounding. And last but not least, dizziness and lightheadedness quite frequently, especially upon standing a lot or even just sitting there. Those are all signs, very, very early onset signs, but these are vague, okay? They're very, very vague signs. So they could mean heart issues. They could be related to other things, but those are things you want to look out for. And then more specifically, again, those are vague, but the more specific ones are going to be if you have hypertension already or high blood pressure already. If you're getting any sort of chest pain, chest tightness, a pressure in your chest, any shortness of breath, again, the breathlessness piece is really, really important and very telling. Pain, numbness, tingling, a heaviness in your limbs, or any pain in your neck and in your jaw, even in your shoulder. Could all be early signs of cardiovascular disease and or potential heart attack risk. So yeah, if you have any of those issues or you've had those issues for days, weeks, months, please go see your doctor. I'd rather you be safe than sorry.
Okay. And our next question is from Ferret Apocalypse. And I'm reading that name and I just started laughing because if you are on
I
Ferret
love
Apocalypse, I want to get a backstory on your name. Do you have a ferret or is this like a prediction? I love that name. All right. So Ferret Apocalypse asked, my doctor told me recently that I'm pre-diabetic. What are my chances of getting heart problems down the line?
Okay, so prediabetes, when we have prediabetes, that's not full-blown diabetes, but it does show us that there is a history of misalignment or mismanagement of blood sugar. And we all kind of know diabetes and heart disease pretty much go hand in hand. When the blood sugar is mismanaged or slightly elevated over time, that causes damage to the inside of the vessels, like what we talked about yesterday, the cross section of the pipe, if you will. So that sugar is inflammatory and damaging to the cardiovascular system because that's the highway that the sugar rides. So prediabetes is clearly going to be less risk than type 2 diabetes, full-blown diabetes, but you still have a 15% increased risk of a cardiovascular disease or a cardiovascular event, even with prediabetes. And then diabetes type 2 is even higher after that. And that risk lasts as long as 10 years. So if you do have prediabetes, highly recommend you're still in that zone where you can catch it, you can reverse it, and you can manage it and really take away that increased risk of a cardiovascular event for yourself.
Definitely. All right. Next question from Dada D. What foods clean arteries and can prevent heart attack? This is a really interesting one. So what foods can clean the artery and prevent heart attack?
Oh man, there's a ton. Okay, so when we're talking straight up foods, fruits, vegetables, grains, nuts, seeds, let's talk about that because there are foods that are in more like the class of herbs, like I think of garlic and things like that. So I'm going to keep that for a later day, but right now let's talk about a lot of the hard-hitting foods. So fatty fish, omega-3 high fatty fish like a salmon, a wild caught, ideally salmon. So what the fatty fish does, as well as olive oil, those are going to increase healthy fat or the good cholesterol that our body needs. And what good cholesterol does is actually clear the inflammation that bad cholesterol can cause. We need a little bit of both, but we need more good than bad. And so when we eat foods that are high in the good quality cholesterol, like fatty fish, olive oils, oils from plants, nuts, and seeds, and things like that, that's actually going to have an anti-inflammatory effect on the vasculature, which is great because that's going to protect the heart and protect the vessels, right? So anything that's going to do that is going to be helpful. Then we have foods like avocado, and avocado again has a lot of the good fat. So it's going to lower blood pressure by protecting the heart and the vasculature. And it's also really high in things like potassium, which is going to be, again, it's known to lower blood pressure as well. And it's a great way to manage fluid retention and things like that, avocado. Next, we have asparagus. We all know that we get the asparagus smell maybe, but I promise it's doing a lot of work on its way through the system. So not only does it have fiber, which is huge for binding to bad cholesterol on its way out the door, but it has a lot of minerals and it has a lot of properties that lower blood pressure and prevent clots from forming. And clots are really important because clots are basically like transient scabs. When we cut ourselves and our blood clots and closes the wound and scabs over, we can have little clots if we get them in our blood floating around in our system. And so asparagus is great at alleviating that potential. And it also boosts the body's glutathione, which is kind of known as the master natural antioxidant of the body. So there are a ton of foods, but those are the ones worth highlighting. Obviously, fruits and vegetables are great too. Last one I'll do is berries and citrus fruit. I have a whole list here, but I know time is of the essence. So citrus fruits and berries, they contain those plant chemicals that we've talked about a lot that are antioxidant, and they help protect from free radical damage. But things like, for instance, and each phytochemical kind of has a different superpower. That's why I always say eat the rainbow when we're talking about citrus fruits, berries, and vegetables. But just as an example, pomegranate, which we know is high in vitamin C, it helps reduce nitric oxide. which keeps blood flowing and arteries open and moving, and it keeps them from getting kind of stale and stuck and hardened. And hardened arteries, like we know, is one of the biggest causes of heart issues. So those are a few foods to focus on next time you're at the grocery store if heart health is important for you.
Yeah, those are really good ones. All right, we have a question from Gladys, and she said, I'm in my 40s. Usually I have blood pressure around 130s over 80s when I measure at Walgreens. Is that still considered okay?
So the 130 over, that's a hard one because that's kind of considered like a high normal, if you will. But that's still technically stage 1, if we're being technical. Because, I mean, so she said 130s over 80s. So I'm guessing it's in the 130s and in the 80s, not 130 over 80, because 130 over 80 is really kind of straddling. But now if we're talking like 133 over 85, now we're in full-blown stage 1. Once we get to 140 over 90 or higher, then we're in stage 2, and the stages just get worse, right? So right now, if it was just 130 over 80, I would say you're straddling the line. But if it's in the 130s and in the 80s, then technically I would talk to your doctor, because it seems like you might qualify for the diagnosis of stage 1 hypertension. And so I personally, as a clinician, I mean, what does okay mean? You know, I don't want to scare anyone, but that is a disease state happening. So you're in, just like prediabetes, you're in the early onset stages enough to where you can catch it and address it in a way that could prevent you being dependent on beta blockers and other, hypotensive drugs and things like that. So
okay.
Hopefully that was
all right. Well, yeah, super helpful. Well, I have been chatting with someone on our chat who wants to get advice, but I'm going to just caveat and say we don't do medical advice here. Everything's like disclaimer. But Chris from Oklahoma said, in the hospital, throwing up and fever and coughing a lot, and wants to know if there's anything they can do to get the fever lower, and is dehydrated as well.
So we have dehydrated, we have a fever. What else was it?
Coughing.
And coughing. That's it?
That's all that was listed. So
okay.
Throwing up, did you get throwing up?
No. Okay. Vomiting?
Yeah.
Okay, so the dehydration is probably from the vomiting, right? We get dehydrated when we eat a lot of fluid. So if we have a lot of vomiting or a lot of diarrhea, dehydration is going to go with that, right? So we have to make sure we stay hydrated. If you're at the hospital, they should be able to put you on IV fluids to help you hydrate. Sometimes you might get even what's called a lactated ringer, which has electrolytes and things in it to help even further with the hydration process. Now, in terms of fever and coughing, those are so nondescript that I hate to, I would be stabbing in the dark if I took a guess. But it sounds like some sort of upper respiratory issue, maybe pneumonia. If you're in the desert, it could be an issue with the dust. Valley fever is big out there, and coughing and fever are big. But it just sounds like an upper respiratory. It could even be signs of, just your standard cold. But I do know that seasonal allergies don't cause a febrile reaction. They have a histamine reaction, so sometimes sore throat and cough, but we don't see the fever traditionally when it's an allergic reaction. So it sounds like your body is in need of the fever to fight something off. Now, if it's at 103 or lower, then your body's doing a pretty decent job of managing the fever at this point. But if it is more than that, then obviously the hospital is the right place, because they're going to manage it, make sure it doesn't get over 103.5, which is where that kind of heat and fever can start causing problems to the nervous system. So it sounds like you're in the right place. It sounds like hopefully they're doing the right tests to figure out what's going on. The vomiting and the coughing, that's another question. So did it start with the vomiting and the fever? Because then that could be a stomach flu. And then the coughing just could be acid burning the throat, secondary to, just like dehydration. Those are both secondary to the vomiting. Now, if the cough came first and then the vomiting, that's another story. So each disease state has its own etiology or process. So it just, again, I can't be completely sure, but I would definitely just trust your team, trust your healthcare workers, talk to them if you have any specific questions, and just, trust the body to do what it knows to do best, which is fighting off whatever it is you have. I'm so sorry you're so uncomfortable, and I hope you feel better soon.
Yeah, definitely. Just echoing what you said. You're in the right place if you're in the hospital, and yeah, talk to your team of medical providers there. Chris said the temperature is 104.5, which is pretty high. So make sure you're communicating all with your team, because they're the ones that can give you that like on-site stuff, and be a real big advocate for yourself while you're there. So feel better. All right, well, let's go to our next one. Joe made the following comment, said, I'm on medication for my cholesterol and I'm worried about my liver.
Okay, so it's kind of a known thing for people who have high cholesterol and are on what's called a statin. Any type of drug that you're on that ends in statin. So if you're on simvastatin or aterostatin or levastatin, right? Statin just means something that's used to control high cholesterol, right? So if you're on a statin and you didn't know, it's for your high cholesterol. Some people are on medications and don't even know. So let's put that out there. So there is a correlation that people taking long-term statins can have liver damage, liver inflammation, the liver doesn't function as well. But the two, and it's kind of a catch-22, because the two most prescribed statins have the highest risk or are most responsible for liver damage incidents. But is it because they're the most damaging, or is it because they're the most utilized? Those are two different questions. So we're not quite sure, but if you're on simvastatin and atorvastatin, those are the two highest. So usually the liver damage and liver enzyme issues stop completely when you stop the medication. So talk to your doctor if you're having any issues with liver problems, if your liver enzymes are high on any lab work, and say, hey, I'm concerned it might be my statin. And a lot of times they're open to changing them so that you can get on a dose that's either less than or on a statin that's not going to cause as much damage. And eventually, if you change diet, lifestyle, increase fiber, take certain herbs like we're going to talk about today, that can actually naturally lower your cholesterol so that you're not even going to be dependent on a statin anymore. And so you don't even have to worry about the liver damage. So, each person's case is super different and super unique. If you're concerned about liver damage while taking your cholesterol medication, then I would definitely focus more heavily on diet and lifestyle and herbal supplements to get you through. And maybe manage with an integrative healthcare professional, like someone like me who works with standard MDs to manage more complex cases, to really work together to give you the most complete care. That's my best advice there.
That's good advice. All right, so Dennis T asked, what are some good exercises to improve heart health? He has some joint pain, doesn't want to do anything too crazy.
Okay, I get this question all the time. So, especially because cardiovascular issues or people wanting to improve heart health tend to be elderly and have old injuries or joint issues. So whether or not that's you, there are 3 things we can do to help the heart. Number 1 is going to be aerobic. You can go as gentle as a 20-minute walk or as intense as swimming a couple miles, cycling a couple miles. Also taking up a new hobby like tennis. Tennis is fantastic, and a lot of elderly people, I'm down in Florida, I see it all the time. They stay active with sports like that. So, those are easy ways to stay active, stay social. If your joint pain is really that bad, aerobic activity might not be the best for you. You might want to stick to gentle weights, like chair weights, doing chair exercises or resistance work. If you can, balance your own counterweight, doing push-ups, pull-ups, things like that can be really helpful. But if both of those are too intense for your joints, I highly recommend some sort of restorative stretching or yoga. Tai Chi is fantastic. You drive around most parks on a Sunday morning, chances are you'll see a Tai Chi group. But yoga and Tai Chi, just nice gentle stretches to really honor and respect any damage to any joints that could be screaming at you, those things are really going to help support and heal the joint and create more endurance and flexibility in the joint. Where the other two are great for heart health, but might put more stress on the joints depending on what's injured, right? If it's just your shoulder, walking shouldn't be a problem, or swimming would be a problem. So, depending on your joint, depending on your issue, those are some options for you if you're interested in using exercise to help support, the cardiovascular system.
Totally. Pickleball. That's like super popular where I live.
It's so popular. Yes. They have tournaments and everything down here. It's a big deal.
Yeah. That's a little less running. So there you go. All right. So next question from Trisha May. Sometimes my chest hurts when I'm stressed and then it goes away. Could I be having mini heart attacks?
Ooh, okay. So a lot of times silent heart attacks are really common. I'm not going to lie. Silent heart attacks exist. About 1 in 5 heart attacks is silent, where the person didn't even know that it occurred, but damage has been done, right? And so what is a heart attack? It is where something has dislodged a plaque, a clot, something, and it has blocked the vessel to the heart. So the heart's not getting oxygenated blood and cell death occurs, right? Musculature, vasculature, all these different cells that make the heart function start to die off because they're being robbed of oxygen, blood, and nutrition because of the blockage in the hose. So when it happens in tiny, tiny vessels, we can't always notice it. And women, present very differently than men. And men, large arteries tend to be affected. In women, it's micro arteries that tend to be affected. So if you're feeling that jarring feeling in your chest under high stress, the chances of it being a silent heart attack, again, silent means no symptoms. So probably not. But chances of it affecting your cardiovascular health, it's definitely putting stress on the cardiovascular health. Now, most of chest pain and things like that aren't heart attacks, which it doesn't sound like that is. If it comes up with stress and goes away with stress, it sounds more like a panic attack or a potential anxiety attack. I know from firsthand experience, it can be very uncomfortable. So I'm really sorry if that's you and you're suffering from them, if you're listening. But I wouldn't be concerned that it's a mini heart attack. I would be more concerned with it being related to stress in the nervous system. And what drives the circulation are the nerves. The nerves are what tell it what to do. So if we start a step back, right, instead of focusing on the heart palpitations or pounding of the heart, take it a step back. Noticing that trigger is much more perceptive. And if stress is the trigger, address the stress, and the outcome should naturally resolve in most cases.
Okay. Well, we have a lot of questions pertaining to heart attacks. Seems like that's a really big topic among our listeners. So I'm going to butcher this name, but I think it's Dugu asked, I heard something about a 1-minute test for checking the risk of heart attack, like you measure your pulse before and after exercise. So what's the formula? How do you test yourself?
So it's actually not a pulse test. It's a push-up test. So Harvard a few years ago did this test on over 1,100 firefighters and then followed them around for a bunch of years to see what the likelihood is of the people who did the least and most amount of push-ups and who was most and least likely to have a cardiovascular event. And what they showed is really interesting. So these were all firefighters, otherwise healthy, no major issues, no heart disease at the time. The average age was 40 years old. And they performed a couple tests, but the push-up test was the most telling. How many push-ups can you do in a minute? And I urge you guys to do this after the call. If you are less than 10, and this is 10 years later they measured, so now these guys are in their 50s, right? And what they realized is less than 10 had a significantly higher risk for a heart attack and a heart issue to happen, where anybody who could do 40 or more push-ups had a 96% chance or lower risk, of no heart disease, no heart attack, no issue. So almost 0%. I mean, it's such a small percentage that 96% of these firefighters who could do 40 push-ups in a minute, 40 or more, basically it shows cardiovascular health, right? So if you want to know if you're at risk, again, this is super informal. This is not a medical diagnosis whatsoever. But set a timer for 1 minute, see how many push-ups you can do. And if you're over 40, then you should be good. If you're not, then it might be a good personal challenge to try to reach.
What about, is it male, female, or does it not matter? Females do 10 at least?
It was both. It was both. Yeah. So what we're, yeah. So, and you can do modified as a woman. So 40 modified, which for those of you who don't know, are knees down. Just because the center of gravity for women is slightly different. So, you know, this study was performed on men, but they did do a later cohort study, and it wasn't as formal, but because they also did a treadmill test and a couple other tests, and this wasn't done with the women, but they did find a similar correlation. And to be honest with you, women are substantially less likely to have a cardiovascular event, at least based on diagnostic rates now, and we'll get into that in a minute. So the focus of the study was on men just because they tend to be a more affected group.
Okay, that's super cool. If anyone needs motivation, I one time found on YouTube a video. It's like a push-up challenge, and it goes to this song. It's called "Bring Sally Up." Anyways, YouTube that. Just
I love that song. I love that song.
It's like all these basically CrossFit or military guys. I don't know. They're really ripped, and they are trying to do it to that song, and it's like up, down, whenever it says it in the song. And by the end, very few are still doing it because it is so hardcore. And there's one guy who's like, he's doing it on his knuckles on like cement, and he's like, it's insane. It's so inspiring. You're like, okay, I can crank out a few more. So it's really fun. It kind of gets you going.
That's insane. Yeah, I can't even. Every time I do a body boot camp workout and they try to like get it to the music, oh my gosh, halfway through I'm like, when will this be over? This is a 5-minute song, please. But it is,
and that's
so helpful.
It is helpful, and that song's really fun because it's like up, down, and then it like holds a while. And you just playing.
Yeah.
Yeah, definitely fun to watch and to see where you're at, and then it's like the challenge is like you're supposed to do it, I think, every day, and then get better and better and better at it. So it's pretty hard. Yeah, look it up. It's fun. It's on YouTube. It's got a lot of hits. It's like millions of hits on it. So, all right. Next question from Lee S. What exactly happens during a heart attack? Is stroke what happens in the brain during a heart attack?
What exactly happens during a heart attack, and a stroke what happens in the brain during a heart attack? Okay, so I get this question a lot. I think a lot of people think a heart attack and a stroke are the same thing, or they happen at the same time. And they can, and their origination is the same. It's just the location is different. So essentially, whether it's in the brain, it's in the heart, or it's in the lungs, you can essentially throw a clot, is what it's called. One of the plaques from those walls can shake loose and then, you know, create a traffic jam. Our blood, our natural platelets can kind of start adhering together and getting really sticky, and the viscosity of our blood can become thicker and more turbulent. That's why we have to take, or some doctors put us on baby aspirin every day, for example. So if that creates a clot, either way, whether it's a plaque or a bunch of platelets, something's blocking the hose, right? So blood's supposed to go through the hose nice and smoothly, and something blocks it and pinches it off. And everything on the other side, so this over here, it's billowing up. It's like a hose just filling with the back pressure. But on the other side, nothing's getting blood, nothing's getting nutrition, and nothing is getting oxygen. And cells require all of those things to stay alive. So then things start dying. Usually there's some sort of bleed out on this side if the pressure gets too high. And then there's death of that cellular structure on the other side. So when it happens in the brain, it's called a stroke. And when it happens in the heart, it's called an MI, or a heart attack. And when it happens in the lung, it's a pulmonary embolism. So the same process is happening, but it's happening in one of the three places. And it can happen in all three if a really big clot is thrown, or multiple clots are thrown simultaneously. But we tend to only see it happen in one area. So a stroke is not what's happening in the brain during a heart attack. A stroke is essentially a heart attack, a brain attack, right? It's a brain attack, a heart attack, a lung attack, right? If we were all to kind of think of the etiology or the cause the same. So what's happening during the heart attack, again, is that blockage. And that's specifically in the heart, and when the heart tissue starts to die, right? Again, if it happens in the brain starts to die. If it happens in the lung tissue starts to die. It can also happen in veins. It's called deep vein thrombosis. But again, that's a whole nother thing. So those are what's happening. That's essentially what's happening in a heart attack and why it's different from a stroke. They are not the same thing because of where it's located.
Okay. All right. Kaya C asked, what herbs do you recommend for heart and cardiovascular health?
Oh, awesome. These are good ones. Okay. So I have kind of, I differentiate herbs between what I call over-the-counter herbs or herbs you can get at the grocery store versus, you know, medicinal herbs. And I know that they're all technically medicinal because they can address health and they can help biochemistry. But the medicinal herbs, you have to go to a specialty herbalist or website or dispensary or tincture builder, you know. So that's kind of how I delineate. So when we're talking over the counter, let's talk that real quick. Every time you're at the grocery store or if you go in your spice cabinet, cinnamon and cayenne pepper are great movers. They help blood flow. They help thin the blood. They're like nature's aspirin in that respect. They help warm the cardiovascular system. And when things warm, they dilate. So we're getting nice movement in the arteries. So those are great natural herbs and foods. When it comes to protecting the heart, garlic all day long. There's an active ingredient called allicin in there. And make sure you chop and crush garlic and leave it sitting for a few minutes, 5 to 15 minutes. And that's when allicin is most active, and then use it to cook with or make dressings or however you're going to use it in the kitchen. Also, turmeric and ginger. Those are highly anti-inflammatory and they protect the cardiovascular system from damage. Also, they all have a great benefit on things like blood sugar, lowering cholesterol naturally, all those things that again are going to be cardio or heart protective. So that's the over the counter, right? Cinnamon, cayenne, garlic, turmeric, ginger, you can get them all at the grocery store. Now, when we're taking it a step further to herbs that help address heart stuff, there's another really powerful handful, the medicinal herbs. Any foods like golden seal or, herbs like golden seal and Oregon grape that contain berberine. We've talked about berberine at length. It's amazing for cardiovascular health, protects the heart, helps prevent damage to the vasculature, like the arteries and stuff. Hawthorn berry. Hawthorn berry is known as crataegus, and it is just like we've talked about milk thistle and how giddy I get, how milk thistle is a lock and key for the liver, specifically built for the liver. I would say that that's hawthorn berry is for the heart. It's very specific to myocardial cells or heart cells, very protective, brings oxygen, all that good stuff. So hawthorn berry for sure. Rualfia and Leonaris. Rualfia and Leonaris are natural antihypertensives. They actually, you take them and within 10 minutes, your blood pressure responds, right? It's going to lower pretty instantly. They're actually pretty powerful herbs. So that's, again, when you want to be managed by an herbalist or a naturopath, and instead of being on a beta blocker, you want to use food and herbal or medicinal level herbs as thy medicine, if you will. You're going to eat a bunch of this stuff that we talked about you can get at the grocery store, and then talk to professionals about herbs that have the berberine, hawthorn, rualfia, and Leonaris. And Leonaris cardiacus is the Latin name, and it means lion heart. And I think that's really cool. So lion heart herb, like that would be the translation. That's what we nicknamed it in herbal medicine class. So I think that that's really cool if you can remember that name. Very specific heart herb. So yeah, it's a cool one. I always think of Care Bears, the lion heart. Oh man, if herbs had a face. Yeah. So hopefully that was helpful.
Yeah, totally. I actually, I haven't done it in a while, but I used to put cinnamon and cayenne always in my smoothie in the morning because I do one with like a chocolate peanut butter and banana. It's so good. It tastes like spicy cayenne frap. It's so good.
Almost like a chai. That's why I really love chai, because it's gingery, warming, I sprinkle cinnamon, on chai. It's just so good.
I'm the same. I love chai. It's so good. All right. Well, let's have our Cheryl H is asking about Middle Road Berberine with Bitter Melon, which is the one I have up here. And she just wants to know, where are these supplements made? And then I'm happy to take this answer from you.
Okay.
So all of our supplements are made here in the USA, in Georgia specifically, and they're made at a GMP certified facility. GMP stands for Good Manufacturing Practices, and it's a certification given in recognition of the fact that products are consistently produced, controlled, and adhere to quality standards. So we get FDA announced and unannounced inspections. We test each lot in the independent lab before shipping out. And some of the things we check for are potency, purity, if there are any heavy metals or contaminants, and only if the lot passes all those tests does it get shipped out. So there is some high quality control, and it's so cool to see it on the little conveyor belt right there. I love it. All right, question from Forgiven Love 09. Last time I bought your supplement, it came with this charm that said, somebody somewhere just thought kindly of you. And I thought it was very sweet. Aw. Well, I get another one with my next supplement, and I'll answer this one too. Yes, you will. Every single one comes with a different charm. Mine hasn't said that charm. I love that one. That's so cute. So every time you're going to get a different one, we call them a whisper around here. They are handmade with love, and they're there to send you healing energy and help you put a smile on your face and warmth in your heart. So here's some that I've got in front of me. Mine says, every day might not be good, but there's something good in every day. Yes. And then this one here says, know your worth and add tax. I love that one. So they're so great. I love them. And you can use them for many different purposes. After you're done with your bottle, you can keep it. You can attach it to a bracelet or a zipper. And you can put it as a gift on the gift tag for someone. So lots of good ways there. All right, next question from CaliFit818. What results do you usually see in your patients who take the berberine supplement? All right, Dr. Jackie, I'm passing to you.
I have kind of figured. I just want to throw in there that I've used the whispers as zipper pulls on. I have one tied on my backpack, and as a keychain. Yeah, they're cute little giveaways too. So yeah, because when I get them, it's like, oh, I don't want to hoard all this awesomeness. So if there's something that when I read it, I think of a specific person, like a friend or family member, I make sure to let them know. And then I'll pay it forward. So, and people like little trinkets like that. It makes their day. So, anyway, yeah, I just wanted to throw that in. So
you see patients, you could have them like out and let people like pick one to take with them home.
Yeah.
Something that
the no look pick test. It's all about the energy, right? The intuition.
Yes.
Oh, it's exactly what I needed to hear today. I love stuff like that. Okay, so you had a question. What results do I see when people are on berberine? Okay.
Yeah.
So with berberine, I think the biggest thing that I see over time is they just feel kind of more vital because again, it's helping the immune system, cardiovascular system, blood sugar regulation. So they just kind of, the first thing I see is they just feel better and they can't put their finger on it. Like they woke up with a little bit more pep in their step for a few days in a row, or they were able to get to sleep a little bit easier. Or they were, a little less uncomfortable after that specific meal. Just in general, like, oh, I just feel a little bit better in my skin. Stuff's starting to feel good and I can't put my finger on it. But the longer they're on it, certain things will happen. So some people have gotten off of their heart medications, have gotten off of their statins. I've been able to help patients reverse pre-diabetes and in rare cases, type 2 diabetes. Again, this is with other things as well as berberine, but berberine is usually part of the protocol because of how many boxes it checks. So I also use berberine in people who have immune issues because their immune system has taken a beating and we're rebuilding their gut. And berberine is really good for immune health as well. And then a byproduct of that is some will miraculously lose weight without trying, or they're maybe they weren't hypertensive, but they were right around 120/80, and now they're 105/68 or something like that, over 70. So their blood pressure is getting lower into a better, more centered normal range versus a high normal. So those are all things that I've seen in practice by using berberines and other herbs, like golden seal and Oregon grape that contain high level of the berberine alkaloid in them. So it's really great across the board for a lot of different things.
That's awesome. All right, next question, also from CaliFit818. I notice on your immune support supplement, you say cardiovascular support. So what does immune support and cardiovascular have to do with one another? And I know I think this too. So when I see immune support, I think only immunity. What does it have to do with cardio?
So how do immune cells get to the disease? How do they travel?
Yeah, through the blood.
And that's the correlation. And that's why cardiovascular health is so important for every system. Digestively, how are we supposed to get nutrition to tissues that are sick or not working well? We're absorbing it in our gut, but is it getting where it needs to go? Maybe we're making sufficient immune cells. Our body's like, hey, I have allergens. Hey, I have, make histamine. I need mucus. Hey, this disease inflammation in this joint. Hey, this, the heart's struggling. Well, how does the immune system sitting there like pumping out its factory of immune cells? But if the cardiovascular system doesn't function properly, or the highway is clogged, or there's traffic, let's say, right, on the highway, things take longer. Things don't work as efficiently. Things don't get dropped off on time or picked up on time, right? So think of the blood system as the highway network. It's how things travel, everyone. It's how things get to where they need to go. I need to turn off at this exit. I need to go up to this next major city or stop. That's the blood system. So when there's a traffic jam, right, or narrowing of the blood vessel because of plaques, when there's a straight up accident in the middle of the road, like a blood clot, stuff stops. Stuff doesn't travel as easily. Things fall behind. Damage is happening, right? Things are affected. And it's the same way with the cardiovascular system. So the heart and immune system are highly integrated. They're constantly cross-talking through hormones, neurotransmitters, inflammatory cells called cytokines, and their balance is super, super important. And so when we're looking at foods and things that connect the two, like a quercetin, for example, because I know that that's, one of the supplements today, but it's going to, once we can address the immune system and support that, and we're lowering inflammation in the cardiovasculature, now the highway's clean, it's nicely manicured, there's almost no traffic. Who doesn't want to drive on that highway, right? Everybody's going to get to where it needs to go a lot faster. And so the immune cells are happier because they're able to get to where they need to go. They can be more efficient in fighting the good fight. So that's why quercetin and other supplement combinations and plant flavonoids are really important for bridging that gap, because they really do work very, very closely together.
Awesome. All right, next question from Health and Beauty 2003. What if I don't see any results? What's your return policy for supplements? And I love this one. I'll take this one. All right, so each person is very different, and what works for one person may not work for another. Totally understandable. So we have a 60-day return policy. And if you send it back within 60 days, you will get 100% of your money back, even if you opened the bottle and used half of it, which is pretty crazy to think of, right?
Yeah.
We want you just to try it and what works for you, stress-free. And if you have questions, you can always contact us through the link on Amazon. We're answering all these questions because we truly care about each and every person that takes these supplements. So we care about you. Test it out. If it doesn't work, send it back. Send it back. All right, question from Trish. What are long-term consequences of a heart attack or stroke that most of your patients usually experience, and how do you help them manage those?
Oh, that's a good one. So remember, a heart attack and a stroke are clots in those specific areas, and think about what they do, right? So if we can think about what that organ is used for, then we can kind of understand what potential long-term consequences there are. So in the heart, if there's cell damage or tissue damage from a heart attack, then the heart's not going to beat as well. It won't be as strong. It won't be as regular. So we tend to see irregular or atypical heartbeat, known as arrhythmias. A lot of people after heart attack will have an arrhythmia. And when the body's electrical system isn't lub-dub, but it's lub-dub, or dub-lub-lub, right? It's a little bit, the rhythm is off, the transduction of the electricity is off. We can see, palpitations, chest pain, just issues in the cardiovasculature and the heart and chest in general. Those are some long-term consequences after heart attack. Also, you're about 20% more likely to have a heart attack 5 years after your first heart attack. In those first 5 years, you're actually pretty vulnerable. So that's a long-term consequence as well. Now, when we look at long-term consequences of stroke, think about what's going on in the brain. Literally every faculty is going on. It's where we speak, it's where we move, it's where we take in visual, like all of our 5 senses, right? It's our balance, it's our executive functioning, it's fear, it's appetite, it's sex hormones. Everything's happening in the brain. The brain's the conductor. So wherever the stroke was, depending on the location within the brain, if there was tissue death in that area, then you can anticipate having issues in that area, right? Maybe you recognize that this is a pen, but you can't say the word pen. Or maybe you can say the word pen, but it looks like a key to you. So recognition is off. So it really just depends on where the stroke is happening in the brain. But some of the most common long-term consequences are impaired speech, physical ability issues, muscle weakness and paralysis, difficult gripping things, like fine tuning, writing and things like that. Again, forming words, those can all be really difficult post-stroke. And I just work with patients the best I can to get them to occupational and physical therapy. If it's a physical or speech related issue, we get them on herbs and supplements. We work on changing their stress levels, their diet, their exercise. You slowly kind of chip away at all of the lifestyle and dietary issues associated to why somebody had the heart attack or stroke in the first place. And once we can increase the level of vitality, health, lower inflammation, then a lot of times those potential long-term consequences aren't really as impactful, right? They're more manageable and we can kind of take the edge off of them.
Nice. All right. So we have 2 more questions. We have about 7 minutes. So let's see if we can crank through them. Erica asked, if heart attack is common in men, why should women be concerned?
So yeah, men are about twice as likely than women to have a heart attack, but women should still be concerned because women, we don't bounce back as fast from heart attacks. And a lot of times it keeps us down, like longer hospital stays, higher mortality rates. So when women finally do get pushed to the brink of having a heart attack, it tends to have more dire consequences. So it is more rare, but it's also more damaging for us as women. Our nervous systems are meant to tolerate a lot of changes because, again, we can procreate and create life. So our vasculature is built similarly. And so we're able to build more vasculature to sustain the life that we're creating, and then we can take that away. And so because we have that ability, it usually can take a lot more for us to develop the same blockages as a man, let's say. But again, once we're pushed to that point, it's the outcome is the prognosis for women is not as good as men. And so that's why as a woman, I'm personally concerned with my heart health. Also, heart health and cardiovascular health is directly related to estrogen and our sex hormones, which is directly related to how we're going to go through menopause and if we're going to get osteoporosis. And so everything kind of touches everything else. And we want to make sure, again, the highway is nice and cleaned and manicured, AKA the cardiovascular system is as healthy and functional as possible, especially in elderhood. That stage of the life cycle is very important. So that's why as a woman, I'd be concerned for sure.
Yeah. All right, our final question. This one's really interesting. I'm going to need all the backstory. Carpe Diem 76 asked, Dr. Jacquie, I know this may be a little esoteric, but I know you're an experienced yogi and have lived in temples. How do you heal heart chakra blockage?
Okay. Ooh, this is a good one. Okay, so the heart chakra. So chakras are energy centers in the body. We have 7 of them. They begin in our sacral chakra, which is right at the base of our perineum, and they go up from there, stopping. We have 1 in our lower abdomen, 1 in our higher abdomen, 1 in our heart, 1 in our throat, 1 in our third eye, and 1 in our crown. Okay. And so there's a belief system that these energies are connected. And so when they're aligned and all open, we can, take source energy from the earth, from the heavens, vice versa, and everything can flow nicely. Each one has a belief, a sound, a color, and emotion, a lot of different characteristics attributed to chakras if you're not familiar with them. When it comes to the heart chakra, if you have a job or you have a posture of curling in on yourself, chances are that's a good physical manifestation of you protecting your heart. You have experienced severe grief in your life, loneliness, lack of self-love, maybe even self-hatred. You've been betrayal, some level of your love was forsaken, and now you're physically working to protect your heart. So that is one kind of physical manifestation. Now, an energy or emotional manifestation of a blocked, heart chakra would be if you're easy to anger, grief, jealousy, crying, you have a lot of disdain for yourself or for others. If we get that long enough, that's going to weaken the heart, because the heart is where we feel joy. It's where we feel love. It's where we feel compassion and connection to other people. And so what's the opposite of that? Any and all of those feelings could mean a blocked heart chakra. It's the way for us to energetically close off and say, you cannot hurt me. I have a force field. But what that does is, yes, it potentially closes us off or protects us from pain, but it also closes us off from joy and from feeling connection in love, which is what we need when we're in grief and in anger. That's what we need the most. So we're pinching it off and we're doing ourselves a disservice. So there are a handful of ways that you can open and balance your heart chakra if you have any issues with this, or emotional stagnation or physical representations of blocking. So one of the best ways in my personal experience is physical yoga. Anything that's what's called a heart opener. So when you're in cobra, when you're in up dog, anything that's bending the back open, dancer pose, camel pose, anything that's really pressing the sternum up, opening and creating lots of space, rolling the shoulders down and away from the ears, looking up, allowing your heart to feel open, to take up space. And any physical postures that allow you to do that will, first of all, physically allow the body to open. Then when we're talking about energy and emotional opening, there are a few things you can do. So just like I said, there's a sound and a color and all that stuff associated. Wearing green is a great, that's the color of the heart chakra. So anytime you're, wearing green on or around, green light, green, anything green in your line of presence or sight while you're doing the yoga is going to really help reinforce, at least this is the belief, that your heart chakra is supported and opened. Also, saying a mantra, the sound of the heart chakra is yum. So it's lam, vam, ram, yam, ham, and it goes down just to give you an idea. So yum, yum, and really working on that mantra and feeling it kind of vibrate in your chest outwardly. As you have heart opening affirmations, I'm deserving of love. My heart space radiates powerful green light. I am a warrior of love and compassion. I accept myself. I release resentment. I release grief. I release anger. I open my heart to others. I open my heart to myself. Whatever feels most right and aligned, saying those things to yourself, head to tail, while you're doing the physical posture, are really fantastic ways to both physically, emotionally, and energetically open up that heart chakra for yourself and feel more compassion for yourself and for others, and really work on the energy or spiritual aspect of, some of the consequences of physical heart disease, of, anatomical and physiological heart issues. So I urge you to try it if you have any of those issues or roadblocks for yourself emotionally or energetically, and see how you feel.
Oh, I love that. That's so cool. And jade, the jewelry, jade, that's a good one to wear for green. If you want
jade
to
is great. And I know this isn't green. Yes, you're absolutely right with jade. And I know this isn't green, but rose quartz is known as the motherly love stone. So if you have a mother wound, that's why you're closed off. If you have issues bonding with other women, let's say, things like that. If you have issues as a mom with your daughters, rose quartz is very healing in terms of a gemstone. So thank you for bringing up gemstones, because those are awesome too.
Yeah. Rose quartz also if you're trying to attract love, right? Or maybe not.
Yes.
But I've heard that one. Yeah.
Anything love. Rose quartz is the love stone. Yes.
Yes, love stone. Okay, well, we have to wrap, but before we wrap, I want to know, when did you live in temples? Where?
So I lived. We should tweak the script a little because it's a temple, but it's more of an ashram than a temple. Um, but I lived in yoga or in yoga. I lived in Rishikesh. sorry. I lived in Rishikesh, India for 5 weeks. At the base of the Himalayas in the Ganges River. And so, yeah, daily meditation, breathing, pranayama, yoga classes, asana, all 8 limbs of yoga were explored. I actually got my teacher certificate in that time as well, and really worked to unplug and focus on the energy aspect of just our physical bodies, our emotional bodies, and I guess how they connect, which to me is the energy, right? That's what really builds the relationship between the physical and the emotional and spiritual. And so tapping into that, it was really profound. Highly recommend if you've never gone and anyone listening has the time and space and wants to explore that part of themselves and that part of health and wellness. I highly recommend it. And Rishikesh is the birthplace of India, in India, the birthplace of yoga. I don't know why I can't talk all of a sudden, but I think I'm concerned about time. But it's the birthplace of yoga, so it's a very clean city, no animal products, no smoking, no alcohol. So it really does allow you to do, a full reset and get connected to your food, to your breath, you do karma yoga, which is giving back to the community. You feel like a reborn person for sure. Yeah, it's beautiful.
So cool. I love that. That's so cool. Are you still teaching yoga?
I do informally for myself and friends, but I don't have a formal class. I was dabbling with doing Zoom during the pandemic, but I feel like everybody who had a yoga teacher certificate was doing that. So, I wanted to leave it to the people who I just did it because I've always wanted to do it, and not as like a major income creator, but just for me to have the knowledge and to help with my friends and family, and just be better when I do go to studios and in my own personal practice, the chanting and the mantras. I wanted to look deeper into it beyond just yoga pants and warrior one, I really wanted to understand it holistically. There are 8 limbs, and we only know in our Western culture 1, the physical postures. And there's so many other beautiful aspects of it. So again, if it interests you, highly recommend.
Super cool. I love that. All right. Well, that's a perfect place to end. So we'll be back next week, Wednesday and Thursday, 4 p.m. Pacific Standard Time. You can always catch the replay. So I will say goodbye, and you can say goodbye too, Dr. Jacquie.
Aw, thank you. And you can call me Jacquie. Thank you so much, everyone who took the time and space to show up. One last heart for our cardio episodes. I highly recommend looking into some of these things. If you have these signs and symptoms, if you're concerned, if you have a family history, please get screening. Please talk with your doctor, and please explore other alternative healthcare ways, because they are there to support you, and you can use food and herbs as thy medicine. I send love to all the places that need it. Thank you so much for joining us tonight. I hope everyone has a great night.
Hear the whispers from within, balance to restore, ailings to relieve. Feel the nature keeping us, nature healing us, flowers, leaves, and roots within. Hear the mind calming you, soothing you, love and kindness inside out. Let the herbs from middle world heal. Welcome wellness, welcome wellness. It's revealed herbs, middle world herbs.